Nitin will speak about another type of IOL which is very interesting.
So, MINIWELL IOL, I'm going to talk about this MINIWELL IOL by SIFI, and I've had a very good experience with this IOL. And there has I was never satisfied using multifocals or trifocals, because you don't know which patient will be really unhappy and come back to you and say that, doctor, I can't bear this. And we have all had these problems in the past, and EDOFs brought a new fresh perspective of giving a good functional intermediate vision with a, and basically I started using these lenses for my early glaucoma and mild diabetic retinopathy patients, where I could not use my multifocal IOL. So that is how I introduced these lenses, and most of the cases that you see are mostly the patients where I could not do a trifocal. So and it has worked beautifully well in this subgroup of patients, because now we can give a premium IOL option through in the form of EDOF to these patients which were not fit for a trifocal. And actually I am shifting completely to EDOFs now, and my trifocal numbers have reduced drastically, because we have some wonderful array of lenses available now. So problem with conventional multifocals, bifocals, that it was that intermediate was not that great. Uh, and then came trifocals, where problem is you see best when you hold that object at the particular focus and not in between. So a patient had to really learn where to hold things, and if you see yourself as a patient, you can imagine how difficult it's going to be, where you have to hold things only at a particular distance to see clearly. And another problem was dysphotopsia, loss of contrast sensitivity. I'm sure all of us have done a lot of multifocals and faced unhappy patients because of these problems. Uh, as Dr. Saurabh said, there are a lot of EDOFs available now. So pure EDOFs are spherical aberration based, like MINIWELL or VVT. This pinhole one is still not available with us. Then hybrid multifocal diffractive, that is Symphony. I think a lot of us have already used. Again, problem was with a Symphony was little halos and glares that patient face, and they are never happy with a near vision. Then hybrid multifocals, like sir has already talked to us about Lucidis, and Lentis M plus X is another very good candidate, and which I also love using these lenses with a mix and match, that they have comfort and M plus X2 lenses that Dr. Saurav is talking about. And then the hybrid multifocal refractive diffractive, that is Technici Energy, that is another my favorite lens, along with other lenses available, because it gives you a very strong near focus. So you can't see, every patient is different, and you have to talk to the patient, understand his needs. Because you have so many available, you can give a patient a lot of choice now after discussing, and do what best you feel is good, whatever is good for the patient. So it's a single piece spheric biconvex hydrophilic hydrophobic copolymer lens. There is nothing special about this lens in injecting. It's so easy to inject with 4 haptic design. If you just tap the lens down, it will just go into the bag, and it's a preloaded design. But as Dr. Kumar has shown beautifully, that sometimes there is a tendency to flip. So it's always good to have a second instrument in the eye when you are injecting the lens. Uh, uh, it is a wavefront engineered lens. The spherical aberrations are inducted in the central pupil, the center of the pupil, that is the central part of the optic, and the peripheral part controls the high aberrations, giving a presbyopic correction. Just to elaborate, the central part of the lens has positive spherical aberrations, the surrounding collar has a negative spherical aberration, and the peripheral part will actually have the IOL power. So interplay of these spherical aberrations create an array of foci, and it acts like a continuous focus. So and it works primarily in the intermediate zone. You can see comparison of MINIWELL and Symphony. You can see for the intermediate part, MINIWELL performs slightly better than Symphony, minus all the halos and glares and other problems which we had with the Symphony. If you compare defocus curves of these MINIWELL, Panoptix and Etilisa, you can see MINIWELL is performing much better in the intermediate zone, where others are dipping down. This is typical trifocal design, where for an intermediate zone, trifocal performance dips and it picks up again for the near. while MINIWELL you can see there is a continuous drop, but for intermediate it's a great lens. And when you compare contrast sensitivity at higher spatial frequency was lower in patients with aspheric EDOFs than those of monofocals. Obviously, monofocals will give you much better contrast, but if you see from these charts, MINIWELL performs pretty well until there is a very when the spatial frequency goes as high as 18, only at that point monofocals tend to be a little better than MINIWELL, but for all practical reasons, I think MINIWELL gives excellent contrast sensitivity. And multifocals would do far worse than this, believe me. So MINIWELL is very close to monofocals when it comes to contrast sensitivity. And halos and glares have always been a problem with multifocals, trifocals, and if you compare all four, MINIWELL seems to do the best for mesopic vision. Photic phenomenons, most of the patients only complained of mild to moderate, but I think they are quite tolerable practically, and I have hardly had any patient complaining about the photic phenomenon. They tolerate it extremely well. Again, Dr. Saurabh also highlighted that point, that light loss. So that will the light loss makes a difference when patient is reading in a little low light conditions. And many times when multifocal patients come back complaining near vision problems, you have to tell them, please hold things in a bright light and then you will see everything, because there is a obvious almost 15% light loss when you are using a multifocal lens, where it comes down to as low as 5% in these MINIWELL or other EDOF lenses. So since there are no rings on the optics, there are hardly any halos and glares. So these 60 eyes, we have done more than them now, but we had a better data of 60, so I have included this. So 90% did quite well. So it was almost N10 for near, and we had to give 1.5 to 2 diopter add for them to read very comfortably even in little low light conditions. So patients did quite well. Key is counseling. If you tell them very clearly that this is for intermediate and not for near, but nowadays with our changing lifestyles, lot of work is done at an intermediate level, and most of them accept it very happily, that once you tell them properly and counsel them properly, they know what to expect, and I've had extremely happy patients using this lens. Contrast sensitivity we measured at 1, 3 and 6 months post-op, and all the contrast sensitive values were in normal range. There was no severe subjective disturbing symptoms. That I have also shared that study, which also said the same thing, that halos and glares are very negligible. And when we gave them a questionnaire, then overall satisfaction was very high, and most of them would recommend the same lens to their colleagues. So if you see this typical defocus curve ranging from 0 to minus 1.5 defocus, it offered excellent vision, and only beyond 1.5 it starts dipping down a bit. And these are some other studies that MINIWELL IOL provided good post-operative functional results for fast and intermediate, and there was no dysphotopsia in this group of patients. And even post-LASIK, this works really well. When they compared different lenses for post-LASIK patients, MINIWELL and Symphony did better than M+ in the previously myopic LASIK eyes, and in previous hyperopic eyes, MINIWELL seemed to provide an acceptable intermediate and distance vision. So even the EDOF lenses are my choice of lenses in post-refractive surgery patients. Like I have done it post-RK, I have done it post-LASIK, and patients have done extremely well on these lenses. So I have stopped putting multifocals in my post-refractive surgery patients. And now they have another addition called MINIWELL Proxa, which I have unfortunately not used. And the combination of these lenses would work very well. You can see Proxa is helping for a near vision. And thank you very much. I think other lenses we can discuss as we.
Thank you, Dr. Nitin. I would like to request Dr. Nagvekar sir to prepare the presentation. Just in the meanwhile, while we transit, Dr. Nitin, any particular experience about this IOL that you would like to share, like any negative experience you had with this design?
Only thing, IL power calculation, I've had a little myopic surprises initially that my patients had minus -0.5, minus -0.75. If I targeted emetropia on my IL must have print out. So I started going little plus +0.5 on, so that then I started getting bang on the result. So you'll have to optimize your A constant, but otherwise it's been a perfect lens. I mean, after a long, this was the first lens which I was really happy with, and then came comfort, and then came VVT, and now you have a wide choice and fantastic lenses.